that we need it at all, right? Okay. Ready for anxiety? Okay, so anxiety. Um, Probably one of the most relevant topics due to the time we live in, the fact that everybody's been touched by anxiety at some point in their life, right? On and off, right? Um, what do we all think about anxiety? What do you?
How do you define it?
That's a great question, because I mean, because in natural medicine, the question is how you define anxiety. I mean, I know there's like a medical definition, but to me, that's really not very good. Because remember, when we learn about the 5 elements, every element has a different type of anxiety. So to me, that's more specific. Remember, the anxiety of kidney, bladder, adrenal is more fear. That's like what the anxiety is coming from. That's what it looks like. That's the most difficult to treat. Remember, the kidneys control the primordial aspects of our body, the waters of the body. I just had this conversation with somebody today. They're talking about their anxiety. I'm like, is it worry or is it actually like fear? We decided it was worry. And like, you can imagine, because worry would be related to earth element, that's stomach, spleen, and pancreas. That's more worry about everything. Your mind's active, you're anxious, but the anxiety is actually worry. So this type of anxiety doesn't necessarily always look like anxiety, because sometimes it's just in people's minds so much, right? This is like a very kapha type anxiety. Kaphas tend to more worry and think more than people give them credit for. And it's this very, again, like silent anxiety. They don't exhibit heart palpitations and tension and anxiety, so they never look stressed. This is also very common as we call earth. But it's very much worry. Worried about what everybody thinks, worried about family, friends, the world, right? But it's going to show up through your gut, stomach, intestinal stuff, right? That's what this lady was having. So anxiety of the heart is going to be probably more like some classic anxiety, where people are going to have this fire element anxiety, right? They're going to have big emotions. They're going to have big chest symptoms, like heart palpitations, pressure in the chest, tension in the chest. You know, they're going to hold a lot of tension there. And they tend to have anxiety that goes into, because remember, the emotion of the heart is paranoia. So people, this is where OCD, ODD, ADD, ADHD often comes from this fire or heart. Remember, the heart is the mind. So this is not worry, this is more like intense. And because we have fire, right, there's more intensity with anxiety. It's very noticeable. People are looking anxious and they're talking fast and they're really classic anxiety symptoms, right? You know, feeling heart palpitations and heated up and fired up and restless and ungrounded. That would be more fire type. Metal type would be related to the lung and large intestine. That's actually more grief. Sadness is actually the root of people's anxiety. So they have anxiety symptoms, but it's actually tied in with grief and depression. So this is why we always ask people when we're working with anxiety or depression, like, which one's worse for you? Like, do you feel like or I always ask this question specifically, do you feel like your anxiety is driving your depression, or is your depression driving your anxiety? Most people have probably never thought about it. But once you ask them, they can figure it out. Do you know what I mean by that?
Would you say that you are always connected? Like if you have depression, you have anxiety and vice versa?
Say that again?
Would you say that you are connected? So if you have depression, you have anxiety. If you have anxiety, you have depression, like,
I think they always go hand in hand somewhat, but not all the time. Yeah. It can be hard to sort through anxiety and depression. That's why I don't like the label of it, like the psychiatric label. Because once you really start to weed through it, a lot of patients that come in have been diagnosed, anxiety disorder or panic disorder or, manic disorder, bipolar. And, when you really work through it all, sometimes it's just, like I said, the adrenals or sometimes it's just more worry or depression when you really go through and weed through it all and look at the root of it. Makes sense? So yeah, remember metal people tend to be really kind of hard to read. If you have somebody in your life that's like, oh, that makes sense. I just thought thinking about it. Metal people tend to be, just really hard to read. Really good boundaries, super good boundaries. So they tend to not be like huggy, touchy, feely types by nature, which somebody like myself that likes to hug and that's like, oh gosh, offensive to my spirit. How could no one like to hug, it's just how we're all made differently, right? So yeah, metal people tend to be more withdrawn, more really clear boundaries, very much will tell you how they feel, and they're very good communicators too. If you can get them to talk, they're very good communicators. Might not like what they say, but they're very direct. But in the nutshell, metal, lung, colon is really more depression and grief. Not even depression, it's grief. There is a grieving process that is flavoring everything. Okay. And then the other one is really easy to spot, which would be wood, which is liver, gallbladder. This is obviously where people are really uptight, type A, very into control and controlling, and the more anxious they get, control is the way the wood people feel safe. So they get more controlling the more stress they get. But it's frustration would be a classic symptom. So the anxiety actually looks more like anger and frustration. So that's why when we're talking to people, that's why we just, when people say anxiety, that really doesn't mean anything to someone like us, right? It's just like a word that is just the general starting place, like saying color. Well, what color is it? I don't know. Is it purple, red? Like you said, this picture has color. What does that mean? That's what anxiety or depression mean to me. Like it's just, we're not getting anywhere yet. Now we got to really get down to it. What does this mean? Okay. Again, this is where we're looking at the Constitution, the individual's experience of their anxiety or depression. And this is where, by understanding what type of anxiety it is, it will get us closer to the root of their problem. Because again, like we said, liver people, it's more frustration, right? Anger, control, people like liver people, people aren't getting on their timelines they have, and they're getting very frustrated by this. Like, get out of my way or watch out, So this is what we have to start asking. And this is why we want to understand the Constitution, because that's how we're going to ultimately help. Let's say, for example, we're talking about liver anxiety. The person's having a lot of frustration, anger. So we're going to obviously give everybody Nervines, right? That has anxiety. But that's like half of it. This is why we're doing constitutional holistic healing. The other half is going to be, we're going to probably want to support their liver. Because if we can help the liver function and improve its overall function, then the emotions of the liver are going to be more balanced. That makes sense. So we're not just going to give people, that's why lavender is very good for a lot of types, because It is a little bitter, so it's good for the liver, right? It is. It is a little aromatic. It is really uplifting. So lavender's a pretty cool example here. Okay, so we want to understand the 5 elements of depression or anxiety. This in my notes. Okay. What are things we can do not even related to herbs to help anxiety though? Because often we really forget about all this stuff.
Go for a walk in nature.
So one of the most amazing things ever for anxiety is, walking. Walking outside, even better. Number 3, just being in nature, communing with nature. The more, to me, like the more raw nature is, or the more nature it is, like the more you just heal instantly by getting into it. This is why we really have to have conservation and stewardship, because we need to protect nature. I mean, not just for us, but for the animals also need real raw nature for their nervous systems to be fine. Right? You ever think of that? I mean, those nature areas are not just for us to look at and partake in, it's also not on the whole system. Animals do that. Right? I mean, deer don't like to hear honking horns and cars over there. Just you can imagine how that jangles the deer's nervous system, right? But there is something magical about going into nature and you just walk out, coming better. I don't know how it works. It's just like I just call it magic. That's why we go to Long Pine and spend time. It's just amazing. Just you don't even have to know it, right? This is why a lot of people who may never be open to counseling are doing things like this without being aware of it, right? A lot of the good old country boys that I grew up with, right? Going out, what do all the time? They fish, they hunt, they boat, they night fish, they do all these things. They're out in nature doing the same thing that all of us that are, loving nature are doing, except they're just not labeling it that. Might not be comfortable with calling it communing with nature, right? But that's the same thing, right? They're getting the same thing out of it. So remember, we balance the elements by being exposed to the elements. So getting our hands in the mud, the earth, swimming in water to balance water, being around the trees to balance wood, right? Having campfires and bonfires to stimulate fire, being in the sun, the ultimate fire, right? So remember, nature, just being in nature somehow balances all these subtle parts of our constitution. The cool thing is we don't have to think about it. We don't have to counsel about it. This happens. And it happens to everybody. Everybody has experienced it. No matter how resistant or recalcitrant someone's ego is, everybody's experienced it. Right? Living on a porch, watching the storm come in. It's one of my personal favorite. Watching corn grow. Listening to corn grow, right? One of my personal all-time favorites. You can hear corn grow, it's a thing, it's for real. It's actually the website has been recruited now. They've actually researched the sound of corn growing. They've actually quantified it now. Yeah.
Can you tape it? I mean, is it loud enough that you could record it? I live in a cornfield. I need to try this.
It's like usually like July when it's really hot, you're getting that really rapid growth rate where it's just about to like tassel out. Yeah, when it's growing like inches in a short time. Like a poppy. Yeah, there's a sound. Yeah.
I'm gonna try this.
Yeah. Yeah, last summer I took one of my friends After I did it, I was like, wow, this is really trusting. Just went to the middle of the room and pulled up to corn and I just threw my tailgate down, like, listen. And I was like, dude, I was like, this is probably kind of weird now taking somebody out. Absolute no.
It's really bad.
But it's really, you can hear corn grow. It's actually. Okay, what else can we do to balance anxiety and stress?
Breathe.
We can breathe, right? Any kind of breathing exercise, right?
Get a massage.
We can get a massage. And remember the theory, the point about breathing is that you can only focus, your awareness can only focus on so many things at once. So if you're truly in the present moment and aware that everything else is not there. Does that make sense? This is like what we're doing with this breathing stuff. Or yoga or meditation, or it could happen during anything, massage or talking with a friend, right? When we really become present to our breathing, if that's the way that gets us to this present moment type concept, then there is no emotion when you're in the present moment. There is nothing. This is whole Eckhart Tolle's whole The Power of Now. That's it. Just you can't have emotions when you're in the present moment. It's just not humanly possible. It doesn't work that way. I mean, those energies are still there somewhere, but they have no presence when you're there. Does that make sense, everybody? I think that's lost in America. Eckhart's been like attacked a lot lately because, a lot of people are trying to say he gets people to like deny their emotions, and that's not true at all. He's just reminding people if you go into the present moment that there are no emotions. It's really true. All that exists is just that breath and moment. That's why we try to get there, right? Or at least 10,000 thoughts, maybe down to just like 5 or 6. Only thinking about our breath, our payment, children, that's still a benefit, right? That's still chatter, emotion, unwinding. So a lot of people just being in nature, that just spontaneously kind of happens too. Yeah, one of my favorite, I don't know if anybody's ever did this, you can watch the earth breathe. Have you ever did that before? You go at sun's rise or sunset. This is the sun starting to come, you stare at the sun. Whereas the sun's going down, you stare at the horizon, right where the sun is coming up or down, and you'll see this purple, you'll see the earth go. Yeah, you see that?
Yeah.
Yeah, I used to do that a lot when I was younger. It was really cool. You don't have to have special Spider-Man eyes or anything. Anybody can see it. You just have to watch. You have to be at a point high enough to see the horizon. Yeah, it's this purple breathing of the tree. You can see the trees breathe, everything. It's very cool. I mean, I'm sure you can see that at any time of day if you're really good at it, but it's easier at that time. Okay. So breath work, breathing, right? Any kind of meditation or meditation technique, doesn't matter what kind it is, right? Just any kind of meditation. This can be like visualizations, right? It's what we call progressive relaxation, where someone's saying, imagine the sun coming into your scalp and going through your head. I like those types.
Because think of Louise Hay.
Yeah.
You can hear.
Yeah. There's a lot of, there's like thousands of these free on YouTube, right? Go through this whole process, walking through your body. That's like a really kind of universal way. That's really helpful. But any kind of guided visualizations helpful. What else can we do to help anxiety before we even get to herbs?
It's like a good night's sleep.
Sleep and sleep hygiene is really important. Sleep hygiene is getting harder to do. So there's the ancient idea that the first thing you think about or see in the morning and the last thing you see before bed imprints your soul for the day or night. So the last thing you look at before you go to sleep imprints your soul while you're sleeping. Forms like a strong, like a stamp. And the first thing you see in the morning also. So for this reason, we always say you should be very protective about waking up really gracefully. Don't just wake up, roll over, pick up your phone and look at like CNN. That's like probably the worst thing you can do, right? A lot of people do that, right? Right? Don't wake up and just instantly listen to the news or see the news. And before bed, again, don't have a screen in your face. At least take like 3 minutes, something. But something positive, or read something inspiring, or poetry, or spiritual writing, or something. But yeah, very important time. Okay. We can do yoga with all these somatic therapies, Tai Chi, yoga, Pilates. I mean, yoga and Tai Chi are probably the best examples of things that combine all the aspects of relaxation. Might take us a while to learn them enough, right? So I think just limiting news, limiting TV, limiting phone screen time, blue screens. Today's world now limiting social media, especially for breaks. If you're really feeling anxious, the best thing you can do is just get off of social media and the news for at least a couple of days. It's really refreshing.
Congress is trying to pass a law on TikTok.
Are they?
Yeah.
See, finally banned.
Oh, yeah, yeah.
Yeah.
It's such a big thing. I don't know. I see TikTok probably, they just announced today they're gonna have a 1 hour screen time for people under 18. So they're probably feeling pressure from political forces. So they make a gesture, You just hit a passcode in and get out of it anyway, so. My 7-year-old has outthought my technical capabilities. She knows every password and everything, so her screen time she just. Boop. I don't even know how she knows it. What else can we do?
Change your perspective.
Change of perspective is a really, really, really amazing thing to do. How do we do that? Or what kinds of things can we do?
Change your thoughts.
So we can change our thoughts, so we can focus on positive thoughts,
Surround yourself with positive people.
surround ourselves with positive people. Yep. We say to heal, you have to have a circle of 7, right? Have 7 positive influences. Humans heal. I suppose like an animal could take the place of something too. So changing our perspective, sometimes we call this just gratitude. That can be like a really good change. Just if we really stop and think about everything you have to be thankful for, it really seems sometimes silly that we're so anxious. We have easily 10 times more things to be thankful for than not. Right?
Go visit somebody that's worse off than you.
So charity and volunteer work is a really powerful tool. I think it's very helpful for anxiety. Yeah, I think all school children should have to volunteer at a nursing home. With AA meetings.
Maybe not for kids.
Or other, support groups of any kind, right? Groups. Yeah. We can read spiritually, whatever our spiritual background is, we can read. Surround ourselves with spiritually uplifting things or positive books, quotes, writings. YouTube has some good things, right? There's a ton of like great inspirational lectures and uplifting stuff, or whatever your flavor is.
Watch comedian.
What's that?
Comedy.
Comedy, yeah, laugh. Laugh is one of the greatest remedies to anxiety. Laughter. What was that? What else was said?
Music.
Music, yeah, music is a great way to help anxiety. And it's different for everybody, right? There's not all music is ever, works for everybody. So people hear my kind of music, they think that's really depressing, melancholy, iron and wine type music. That's just, yeah. I told you every time I try to play it on vacation with my mom, she's like, "This is so depressing. I don't want to listen to this." So. But it'd be different for some people. Punk rock could be relaxing in a way. Like me, I can imagine that, but to some people, it really could be, right? Very cathartic. So music, yeah. Anything else?
Like tea, a dog, or.
Tea. The process of tea is a super helpful, relaxing process, right?
Pet, dog.
Pets, animals, again, we have the healing power of nature, right? The animals. Animal therapy, right? This is really getting promoted to vets right now, which is really cool. That's great therapy for vets that have PTSD. They can now get, I think, reimbursed for adopting a pet now, or they're trying to do that. It's all the news the other day. What else?
Sensory therapy.
Sensory therapy, like,
Getting your body just paying attention to simple feelings, sensations, watching like water.
any kind of, yeah, sensory therapy. This would include a lot of modern things, even like saunas. Cold water plunging, the Wim Hof type stuff. Very sensory driven, but that can really just really restore our nervous system in ways that we're only beginning to understand. Aromatherapy would be a sensory therapy, color therapy, right? So there's a lot of different ways we can do that. I think one thing that's really important to remember in anxiety, maybe the most important, is choice. That we do have a choice how we want to perceive the stress in our lives. And we do have a choice with how we want to respond to the stress in our lives. I just trying to talk to my younger daughter about this the other day. She's like, we don't have a choice to be stressed or not, Dad. Like, oh, we do. It's hard to remember that when you're in it. I mean, for anybody, it's hard to remember that.
What about desensitizing yourself to whatever's causing your anxiety?
But yeah, desensitizing, there's a lot of ways to do that. Counseling or meditation.
Or doing it, so enough times you don't feel anxious anymore.
Doing things, yeah. Yeah, Master Chen's famous for doing things like that. One of the students had anxiety of driving on the interstate, and I told her to drive her to the grocery store or something. And so they got close to the on-ramp, we just took the wheel and like went on to the interstate. And then just let go of the wheel, so she, this person was like forced to like face. That's pretty intense.
Wow.
But she did drive and like actually just overcame it right there. That's like, that's kind of Tony Robbins does a lot of stuff like that. Like, what are you afraid of? Okay, here, we're gonna jump out of a plane right now. You're like, oh my gosh. What's that? Yeah. So we have journaling, one of my personal favorite, journaling or counseling. We haven't talked about counseling. Counseling obviously is a really good thing. And there's a lot of types of counseling, right? We have professional counseling, counseling we get by talking to friends and loved ones and elders and wise people, right? But we also have professional counseling too. Sometimes nice to have somebody to keep us accountable, give us insights. That's a pretty good, I think, general list of a lot of tools we all have access to in our toolkit, right? Are you?
Don't you think there's some people though who have had their anxiety so long, it's almost a comfort to them? Like being without it is more fearful than being better.
Yeah, we've talked about that in class often in the healing process. People, I first saw this with fibromyalgia patients sometimes, but they would heal and get better, but their identity, their life, the way they interacted with family and friends had changed so dramatically, they weren't ready for it. So they kind of fell back into it as like a comfort kind of, yeah. So we can become really kind of what she's saying is identify with our anxiety. This is why we also want to always avoid the anxiety pissing match, right? Like where we all have this tendency to think our anxiety is worse than everybody around us. And that creates like a lot of victimization inside of ourselves, right? And there's some people out there that have some severe anxiety life situation that, would just shock us. So I think it's important to not get into that kind of contest, or when a lot of people are seeking help, one of the natural defenses as well. I understand, about stress, but you don't really understand like what I'm going through. Or my type of stress or my level of stress. And it's kind of the same thing. It's about getting together. But yeah, remember, as we heal, we kind of peel through things, and our anxiety can be something that we're very familiar with. We see this, what's the first warning when people come to see us for anxiety support? What's the first warning sign there's going to be a bumpy ride? First thing they'll say to us, they say, "Want help with anxiety?" And then the second thing they say after that is what?
Nothing works,
What's that?
nothing works, I don't know.
No. They'll instantly say right after that, "But I don't want to be too relaxed." That's this idea that they just is telling us they identified with it as comfortable, but they know they don't like it. But there's still a part of them that's saying, "But I don't want to like be totally indifferent from it." A lot of people say that. A lot of people have anxiety over even taking things. Will often say that. Like that's just like a warning sign when people say that you want to really talk to them more, educate them, spend time with them, make sure they know that you're gonna remember, you're gonna be more relaxed, but your mind will be more focused, not sedated like with the drug. That's where whole medicine's
Is
quite
that
different.
kind of where you think they're coming from a lot, is like taking medication, like kind of just numbs them up, am I?
Yeah, some of them could do that.
Or the control thing too.
It's often a liver response, the control, thing, yeah. I don't want to be out of control of how relaxed I am. Yeah. Sometimes it's a guy, a lot of ego guys, like big country dudes that I've seen in the past, like cowboy types, and kind of like don't feel like too relaxed now.
So I mean, like, so they associate being with relaxed, like being depressed, or like have like
A lot of people do.
depression where they can't get out of bed and you're just like.
Yeah, or a lot of professionals or liver with types identify relaxation with non-productivity. So what I usually exactly say in these exact words is like, you're going to be more productive because your mind will be more focused, more calm, you'll be better able to achieve what you want to do. You're just going to be more relaxed and good. And again, that's the thing we have to remind everybody we work with too, is that drugs or anxiety are completely different than natural medicine, herbal medicine. This night and day off the charts, totally different, right? In so many ways. Number one, none of the herbs are habit forming or addictive. That's right out of the gate, that's the big difference. So we want to like speak to that when we're working with people or trying to help people, to remind them that you're not going to get addicted to an herb. In fact, typically, once we find an herb or an herbal formula that works good for anxiety, that will probably work for the rest of their life for people to some degree. They can always keep coming back to it later in life. Right? Okay, we also always want to know the origin story, like when did this anxiety start? Because that's going to tell us a lot, right? Was it with, postpartum after childbirth? Was it with divorce? Was it with trauma as a child? Like, what was it after you had, some people get it after viruses, they can have anxiety type patterns. That's a long haul COVID symptom for some people. So this shouldn't surprise us, because I mean, we've known that viruses can do strange things like that. So we want to know the origins. When did this first start? What was the climate at that time? Okay. So let's talk about some other reasons you might not have thought of why people would be anxious. That we haven't talked about a lot in class. I mean, yes, we have trauma and all these things, but we also have to understand that our body is physical. It's made up of all these cells, and these cells are made up of nutrition, vitamins and minerals. So if we don't have optimal vitamin and mineral status, we are possibly going to have that cause our anxiety or depression. Right, this is called nutritional medicine or nutritional psychiatry, whatever you want to call it. It's the idea that if your anxiety or depression is caused by a nutrient deficiency, guess what? Why in the heck would you take anything else if that's the cause? Because it will not get better until that part is treated. A drug may pacify it, or an herb may pacify it, but it's not going to get better until you treat that biochemical reality. That makes sense? So what are some nutrients that we know are often linked or associated with anxiety?
Magnesium B3,
What's that?
vitamin B complex and B3.
Okay, so we have vitamin D is associated, deficiencies associated with depression and anxiety. Not super common with anxiety, but it is there. Okay. The B vitamins, we've got like a lot. It's kind of a generic term, right? Let's see if I have a vitamin lecture. A lot of these don't have it. Okay. So B vitamins, why are B vitamins so important for anxiety? How do they function with anxiety? What's some, first of all, we should know B vitamins is a horrible term we should like disregard. When vitamins were being labeled and identified, these were all discovered in area of like close to each other, but they're not related at all necessarily. This is like a important and a myth that's there. They're not like a family of vitamins. It's just that they were all discovered around the same time, so they're labeled like B1 through 12. But I think we all think that, I often forget that sometimes, that they're not necessarily all a big family. They do have similar functions, but I mean, they're not necessarily like a biochemical family per se. So we have a lot of B vitamins, right? we fortify our food with them, right? Because we know you get some really big problems when you don't get B vitamin. So B1 is thiamine. Okay. Trying to think of which ones we fortify with B1 and 2, right? And B, we fortify with folic acid too. B2 is riboflavin, B3 is niacin. I'll make sure I get them all. 5, 6. 6, 7. See how these were named? Okay, B5 is I think acid. B5 is pantothenic. You can just there's all kinds of really cool handouts I can find and send everybody. B6 is pyroxene. I never like to spell. B7 we also call biotin. B9 is also called folic acid or folate. 12 is cobalt. All of that. Okay. These are all essential. A lot of these, especially B1, B3, I guess they all. I guess really all of them to some degree. These are what a lot of your nerve tissue is made with, first of all. So you need this just for your body to constantly regenerate, heal, restore, and maintain nerve function. A lot of these are involved in nerve transmission and functions in the body. But one thing that's interesting is that all of these are excreted and used at a much higher rate during stress. So based on what our body is going through, we may be consuming internally large amounts of these. So this is why these show up often during times of stress, and then it gets to be like a snowball effect, because stress will contribute to them being deficient. And the more deficient they are, the more anxiety type symptoms they can sometimes have. We especially know in extreme situations, what are some more extreme symptoms of these being depleted that often occur with stress? Nerve pain is one of the big ones, neuropathy or nerve pain. Hair loss. Problems with fingernails not growing anymore, having fingernail problems. Burning tongue, burning mouth. Numbness in any part of the body, especially the face. And then pretty much every anxiety symptom has been linked with that. Some of them, I mean, if we get deficient, it's down, right? Like if you get deficient in B12, I mean, you can actually lose control of your muscle. You can't move. I mean, really, your body starts shutting down if it's extreme. So it's important to really, it's hard to eat enough B vitamins. It really is. I mean, we can and we can do it. But if we have an actual deficiency, it's hard to just treat that with food because they don't occur in like when you take what's called a B50 or a B, usually there's two types of B complex, like a B50 or B100. mean, we're talking like, this is like. Not an underestimation, this is like a 5-pound bag of rice, basically, and even more than that, probably. Talking like a lot of rice, a lot of grains to get what would be in a single. B50 or B100. I mean, this is why you look at old. Medical writings and people used a lot of like sources of B vitamins. With herbs because they didn't have vitamins back then. I mean, it would have been really hard to like build somebody up. It would have been really complicated. So we have a lot of superfoods from the old days, right? Like brewer's yeast and nutritional yeast and blackstrap molasses. I mean, there's a lot of places where people would have got these in like super concentrated versions. But that's something to think about, especially when people are getting a lot of nerve type pains and hair loss and lack of hair growth and that. If you have actual nerve disease like MS or Parkinson's, I mean, every doctor is supposed to check you for at least like your folic acid and B12. Because if you're depleted in those, all the nerve, the tremors and shaking and loss of muscle coordination are gonna be like worse. And again, if your anxiety is provoked by this, maybe caused by this, I mean, we can do a lot of things, but until we treat this, it's really hard for that to resolve. So this is why we often want to look at like the nutritional causes of anxiety also. It's not all just life stress.
Is it possible sometimes your body just doesn't absorb these?
Sure, well, for lots of reasons, right? We talked about that MTHFR condition, right? Where you can't absorb the folic acid very good, and yeah, there's a lot of reasons. Acid reflux drugs, for example, prevent the absorption of these from being very efficient. The worst drugs, right? That's very common, like people take it like candy, right?
Mhm.
Yeah, acid reflux is gonna influence how these are absorbed.
So how do you hop
Liver,
around?
gallbladder function.
Is there an herb that helps you absorb these a little bit better?
Yeah,
Methylated.
Methylated.
so yeah, we can take the methylated, what's called the methylated B vitamin complex, which will help absorption. I mean, they're really not that much more expensive than regular B vitamins. Methylated B complex. But a lot of herbs that affect digestion or liver function are going to improve the absorption. And then a lot of adaptogens have been shown to improve B vitamin absorption. Ashwagandha has, and Chinese ginseng, and American ginseng. So fatigue would be a classic example of these being related to. When we start to see all these things together, sometimes we have to kind of rule this out. You can test the blood for all these individually, it's pretty pricey. It gets pretty pricey. Okay,
Can you do anything else to find out?
one of the, like, really in today's world where people don't often have very good health care. The easiest way is to just take like a B complex for a week or two and we'll see if you feel a lot better. Yeah. So by definition, if you have a nutrient deficiency and you build the nutrient up, the symptoms should improve in 2 weeks. That's like a definition of a nutrient deficiency. Doesn't mean they'll go away totally, but they'll leave. I think we have the impression in America, because we have all this access to any food in the world, that we're not nutritionally depleted, and we're probably more nutritionally depleted than we have been in the past for a lot of reasons. All these nutrient deficiencies, and younger doctors are even less trained than older doctors on this, by the way. Yeah. I had a client that we'll talk about it with the next one. It's a good transition. Everybody's okay with this? So often we don't like people to take just like B1 or B2. We usually prefer to people to take this, all of these together. Because it's, unless you've had a test and know, it's just a little bit of a shotgun approach, but it's kind of practical. And these are all water soluble, so whatever you don't need, just go flush out. Right, when you take these, your urine's gonna be a little yellowish, even if you absorb it really well, it's just gotta be. So. Okay. Okay, so let's do, we did vitamin D. About that. Two other really important ones.
Magnesium.
Yeah. We'll get into the. Okay, let me make sure we made this point about a B. Is what we call a B50 complex and a B100 complex. These just kind of refer to like how potent the combination is. So B50 would be more kind of lower strength, the B100 would be more intense. So it'll have all of them listed on there in the product though. Okay, another major player with anxiety is going to be calcium and magnesium. So a lot of this, we don't necessarily have the blood test for because kind of symptoms will kind of guide the understanding of it. So calcium and magnesium tend to have some really classic deficiency symptoms. Know what they are? So cramping of the muscles or spasming of the muscles. Or a loss of muscle control, like a complete loss, like paralyzation. I just had a client a while ago who these are tested in your blood, by the way, like you're a pretty common blood test, but just because your blood has a lot of these doesn't mean your rest of your body does. You can still be deficient in different tissues of your body. Because these are commonly checked on blood tests. Because if they're really low, it's very life-threatening, very fast. So some symptoms would be, yeah, muscle cramps, muscle spasms, restless leg syndrome, actual like contraction where muscles stay contracted and flexed, like what we call rigor, you just become rigored. In severe cases, you can just lose complete motor control. So I just had a client, she was very healthy, like never had any nutrient deficiencies ever. I think she had a surgery, had some stress. It was like a knee replacement, it wasn't anything dramatic. Like last summer, we lose a lot of calcium magnesium through sweating. Away, and B vitamins also, we sweat them out quite profusely. This is why B vitamins are a great bug repellent because they do come out of your sweat, your pores. It's an old fashioned bug repellent for mosquitoes to take a lot of B vitamins. They don't like the smell of it. This client literally tried to go to the bathroom, like her whole body like seized. It just would not, she could not move a muscle in her body. And luckily her husband was there and she called out to him. She could kind of barely move her jaw a little bit. And she was like kind of collapsed on the sink. And like, I mean, without him being there, she would have probably just fell. And I don't know what happened. She would have laid there indefinitely. Like, yeah, her complete body would not move and all her muscles like kind of like were like seized up. So obviously they took her, the ambulance came and took her to the hospital. She had like critically low levels of calcium and magnesium. Just kind of just, I mean, these things can sometimes happen. They can kind of come out of nowhere. Usually there's a reason for them. But yeah, when people have a lot of achy muscles, teeth grinding is a common deficiency symptom of this. People who chronically grind their teeth. People who crave dairy products without end are often deficient in calcium, magnesium. They say chocolate cravings are from magnesium deficiency because it does have magnesium in it. But these can cause insomnia, anxiety, all kinds of anxiety symptoms. In fact, these natural sources of these were added to a lot of old Chinese formulas for insomnia and anxiety. You know what the source is? Called dragon bones, the fossilized bones. Because bones are made of calcium and magnesium, right? So they just still use them some. Just bones. The paleontologists are really upset now because there's still some of this is still being done in China and
So
you
would
know,
bone broth be helpful?
bone broth would be helpful and collagen, like making homemade bone broth, yeah. So these are really essential not only for bones, but also for hair, skin, nails, and also the nerve tissue itself is largely compromised of like calcium, magnesium too. So it's like the sheath or like the coating of the nerves is mostly like B12. This is like, so like, I think MS is a demyelinating disease, so like the myelin, the coating on the nerves like just disappears, so like this is why B12 is so important for things like that in the early stage. You know, getting it before it gets to be a problem. So how much calcium or magnesium would we maybe want to try if someone's having leg cramps and restless legs and anxiety and craving all kinds of things? Kids who eat chalk, it's often calcium. Pica, like when you have cravings where your body will just, it will get what it needs. So we call it pica. Pica. Like where people will eat like part of a couch or a cushion or something. So pica is like where you have a nutrient deficiency and you eat weird things like chalk or dirt. Dirt, people that eat dirt is often calcium, magnesium too. So there's some weird things your body will do when it's deficient.
Is it like, do you crave ice chips or ice cubes if you're like iron deficient?
Yeah, it's more anemia, crave ice and chew it all the time. Well, some of it's just kind of weird. It's kind of quirky. Yeah, dizziness is a vertigo, dizziness is a real common deficiency with this. I mean, obviously osteoporosis is something we all have looked at with this. So how much like calcium, magnesium, and what type do we want to do? That's like the next question. We got a lot of options, right? What type of calcium they want to do? And people really get cheap about this kind of stuff. I
Calcium citrate liquid.
So we have a lot of types, right? We have, you know, citrate, carbonate, malate. I think there's 9 types altogether of calcium and magnesium. These are just different ways calcium occurs in nature. They all have like a little bit different of that absorption, but really honestly not enough to make like a huge difference. Talking like a 5% difference maybe between all of them. So it's not this like radical thing that people that sell calcium mention. Yeah.
But do you feel like calcium is well absorbed in a tablet? But
I
that,
mean-
because I took it, that osteoporosis,
Mhm.
it didn't really seem to help. And it made my knuckles
You,
So
Yeah.
it didn't go,
Were you doing magnesium with it though, or?
no.
Oh, that's the problem. If we do calcium
They
without,
can say, take more, take more. Oh my God.
yeah, if we do calcium without magnesium, which is what your medical doctor is gonna recommend in Omaha, Nebraska. They'll probably say it take it with vitamin D.
That's all they said.
Yeah. But calcium by itself will create more calcium deposits in the body and your knuckles can get all,
Giant.
yeah, large than that. So I prefer calcium citrate. If you are on an acid blocking medication, citrate is essential because calcium needs acid to be absorbed. Citrate does not need as much acid to be absorbed, so a common cause of osteoporosis is quite frankly acid reflux drugs. Any spine surgeon will tell you that. The spine surgeons hate acid reflux drugs. Vertebrae surgeons hate acid reflux drugs because it is what often causes osteoporosis and spinal degeneration and that.
that's like pride, blood.
Sag, Nexium, they all do that.
Do they call them PPIs or something?
There's different, yeah, some are PPIs, yeah. we're calling them inhibitor.
Okay.
Yeah.
No.
But remember, everything has a purpose in the body. The acid is there, it helps absorption process. So if you shut it down, you just can't absorb a lot of things. And this is not like fake news. This is just, you can look at the drug insert for Nexium and it'll say this will cause osteoporosis.
There's a lot of calcium, magnesium, and zinc all together.
Yeah.
In vitamins that are on. I always
So-
thought I should take that vitamin.
So we would want to do calcium and we want to do it with magnesium. We never take calcium by itself because number one, it's super constipating. And you're not going to absorb it very well. And we don't always want to take magnesium by itself, but it's not as bad as taking calcium by itself. But calcium is constipating. This is why cheese is constipating and magnesium is a mood balance. So when you get them in the right ratios, it works pretty well together. The ratio is usually like 2 to 1. Like 2 parts calcium, so usually we do like 1,000. For anxiety, 1,000 milligrams of calcium is enough. Total in a day. And magnesium would be 500. Again, we're talking about citrate preferably. If we're taking this for the bones, we would want to probably have vitamin D and zinc and things with it, but for anxiety, we're not as concerned about that. We just want these nerve functioning nutrients. Okay. The problem is you also have to read the darn label because calcium and magnesium are really bulky substances. They're not like, it takes a lot of pills to get enough, basically. You know, if the reason why we don't have the 1-a-day chewable, because it would be like the size of like a golf ball. It really would, it'd be about the size of a golf ball. So we have like these chewables, usually have to take like 3, 4, 5 chewables to get like this amount. So you have to really, gummies or even worse, like you gotta really read your label. You know, usually say this amount, but like for like 6 capsules or something. So it's a lot. So this is something we would want to try for people that have anxiety, that are having some of these other muscular indicators that makes us think of that. Family history of osteoporosis, or they have osteoporosis, osteopenia. We would start thinking about this. There is a weird thing too, is when you take calcium and magnesium at night, for some reason, it works better. So what a lot of people do is you can take half your dose in the morning and half at night before bed, or you can do it all before bed. Nobody really knows why this happened. It's probably some hormonal thing. But you absorb it a lot better. Remember, calcium, magnesium are minerals. Minerals by nature are grounding. All minerals are grounding. They occur in grounding foods, but they're grounding. So, taking a nervine and adding a little calcium, magnesium can actually increase its sedative or grounding properties in it. So it's something to kind of keep in mind. A lot of herbs we know, like skullcap, and a lot of herbs have these minerals in them. That's one way that they work. One of the many ways. It's a really good old book called Nutritional Herbal Medicine or something that had all the vitamin mineral profile for every common Western herb. It's pretty enlightening. But you can imagine most of your nervine herbs, anxiety herbs are all going to have usually some degree of calcium. I don't know. Okay. Everybody's okay with the calcium magnesium part? This gets asked a lot. These are probably like the major nutrients that function with anxiety. Okay. So also we use calcium magnesium a lot for people that have a lot of fibromyalgia pain, muscle stiffness, muscle cramps, all those muscular type symptoms.
So I take magnesium if I feel like I'm gonna get a migraine.
Mhm.
Would it be more effective if I took calcium with it?
Usually not. Magnesium is a vasodilator, so it affects the dilation of the blood vessels in your head. So it works differently than calcium.
Okay.
So not for migraines, you do not have to take calcium with it. But you do have to be aware anytime you're taking magnesium by itself, usually after 400 milligrams, you're probably going to run into a stool if you don't have calcium with it. Does everybody get that? It's like, to me, that's the threshold. It's about 400 milligrams. What most people feel after that, you might start to run into a stool. The magnesium, the Calms powder, that's really popular as a supplement, which works awesome. It's about 600, right? I think 2 scoops. It's pretty good dose, pretty good amount.
It gives me anxiety.
Does it?
Isn't that
I don't
wacky?
know. No, I mean, there's probably some good explanation for that.
Fine.
Okay. We got a couple minutes to get into the herbs, so.
When you said for the fibro, is that the calcium, magnesium, or the calcium, magnesium, zinc, and D3?
For the fibro, it's just, for the nerves, it's just calcium, magnesium. You don't have to have D and zinc and all that. The D and zinc just helps absorption like into the bone, but not into the nerve tissue. Makes sense? Okay, let's do maybe one more that might surprise people. Another common cause of anxiety, believe it or not, is an omega-3 fatty acid deficiency, which is pretty rampant. This is also a cause of adrenal fatigue syndrome sometimes, because we just don't eat enough healthy fats and oils, especially with the popularity of like low fat diet stuff and low fat diets. So, because remember, the nerve tissue is made of B vitamins and basically fats, like omega-3s. So they are essential for nerve health. So typically, what are some symptoms of essential fatty acid deficiency? That would be easy for us to spot as a practitioner. Best one, bumps on the back of the arm. Keratosis, right? Totally related to fats and oils. Dry hair, dry skin, pretty much every low thyroid symptom, fatigue, depression, cold hands and feet, low body temperature, all these types of things are super common, but especially dry hair, skin, nails. We also know that even if you're not deficient in these, that omega-3 fatty acids, although they're not as strong as Nerver, they still can help a lot of depression, ADD, ADHD, anxiety disorders, because they do affect brain health. But don't expect to take this and get like a skull cap nervine effect. It's very slow and gradual, and you don't notice it like in a way that you would an herb. But it can be helpful for chronic anxiety, chronic depression, especially in people that have a restrictive fat diet. Okay. How we're going to get these? We could add it to the diet. How?
Flaxseed.
Yeah, flax seeds. Or any nuts, right? Any seeds. All of our cooking oils. Ghee, like clarified butter, dairy. Grass-fed dairy is going to be somewhat some of these, right? We have a lot of vegetarian sources. We also have all the fish, right? Fish are going to have. These are really essential just for the background. Probably the most research is depression, because we know now that depression is largely like an inflammation process, and these affect inflammation. And there's newer evidence showing even anxiety is triggered by inflammation. So these oils, they also help the inflammatory process. We can also take a supplement of any of these, right? We can take flaxseed oil or fish oil.
What brands do you recommend?
For fish oil, like. For flaxseed oil, we only do one, right? We do Marlene's only. It's the only one we use or carry. Flax. For fish, we do either Carlson. Nordic Naturals. Nature's Way. There's a few of them that are pretty good. Fish. Like for kids, I mean, the flaxseed oil smoothies that are pre-made, they're really delish. Fish oils are always gonna have a little bit of a taste, right?
Naturals are.
I mean, they're okay. Yeah, they do a decent job. So we're especially gonna see dry symptoms, right? Deficiency, dryness. The tongue's gonna be really dry. It'll make it through deficiency too. Okay. Okay. So next week, let's do all the herbs. We have like a good background of what we would do. Nutrients, lifestyle things. Now we need to do, obviously, relationship counseling is really good if you're having stress from relationships. It's always one we forget to mention. Or that could cause more stress too, but. It's bad. Okay. Questions? Next week, we'll just do all the herbs, try to get through all the herbs. Should be able to get through it in like an hour or so. And we'll move on to, next week is a guest speaker. Mary Reig, the doctor of pharmacy, is gonna be doing I gotta double check. I think she's doing like functional medicine labs and things. Yeah. She's really good. She's super smart. Really. It's like top level. Yeah, she has certificates and anti-aging, certificates and some kind of stuff. And she's a great person.